Whether you're a new or expectant parent, this is undoubtedly a very difficult time for you, but there are ways that you can minimise the risk for both you and your family during this pandemic. COVID-19 is a coronavirus. Coronaviruses can cause respiratory illness and they present differently in different people because everybody has different immune systems. As yet, there's no vaccine or treatment for COVID-19. COVID-19 is spread by respiratory droplets. The virus lives in these droplets, and when you sneeze or cough onto someone else, the droplets can land in their eyes, nose, or mouth, and then that person becomes infected. Alternatively, people can pick up COVID-19 from surfaces and objects because the virus can survive for days on some materials like plastic. This knowledge, the general lack of specific information for parents, and physical isolation, amongst other things, can cause heightened anxiety when you're a new or expectant parent. However, based on the evidence, pregnant women seem to have about the same risk of COVID-19 infection as the general population. Even if a pregnant woman is infected with COVID-19, it's expected that most will experience only mild or moderate cold or flu-like symptoms. For infants and children, the risk of COVID-19 infection seems to be lower, or at least the symptoms are less severe than that of the general population. There will be some changes for expectant parents as a result of COVID-19. So the Royal Australian and New Zealand College of Obstetricians and Gynecologists states that hospitals are still the safest place to deliver. However, there will likely be some limitations to the number of visitors allowed, and early discharge from hospital will be considered. Already, most antenatal classes and some routine appointments have been moved to telehealth, while antenatal and postnatal visits may be limited in time and/or may occur less frequently than usual. While physical distancing remains the most effective way of preventing COVID-19, there are other measures that new and expectant parents can consider, including regularly washing your hands, especially before and after touching your child, after blowing your nose, coughing or sneezing, going to the bathroom, and before eating or preparing food. If soap and water are not readily available, use an alcohol-based hand sanitizer with more than 60% alcohol. Clean and disinfect surfaces and objects, such as tables, countertops, and toys. Follow recommendations for cleaning feeding equipment like pumps and bottles. Sneeze or cough into your elbow. And have essential items like groceries and medications delivered to your home. If you or your partner have a fever, dry cough, or any other concerning symptoms, please contact your GP immediately.